For it is in giving that we receive. To North Star Hospice with love and appreciation. Those are the words of Magdalena Reynolds, our board chair, in 1985. In 1983, Dr. Bayard French traveled to England to research and observe the hospice movement. By 1984, he was able to develop a board of directors and initiate North Star Hospice in Hibbing, Minnesota. The funding received came primarily from the United Way and community donations. It was on October 22nd, 1984, that we began to provide services. The hospice was primarily staffed by a dedicated group of volunteers and provided pieces of hospice care to the local community. In 1985, Beth Meadows took the position as the hospice coordinator. Beth continued to work with the community to actively fundraise for North Star Hospice in order to keep the doors open. The volunteer hospice group contracted with 2 local home care agencies, which at the time were Healthline Home Care and Home Care Specialists. These home care agencies were able to meet the nursing needs of the hospice patients. By 1988, with the help of these agencies, North Star Hospice had cared for 140 terminally ill people in their homes at no charge to the patients or their families. Over the course of the next 15 years, the recognition of the hospice continued to grow. It was due to the overwhelming community, individual, and business support that we were able to be sustained financially. All of hospice's services continued to be funded solely by donations and grants until the early 2000s. Medicare recognized the need for hospice services, and on September 30th of 1986, a Medicare hospice benefit was developed. It was in March of 2003 that North Star Hospice became a member of Fairview Range Regional Health Services and began to work toward Medicare certification. This process was completed in December of 2003. This allowed North Star Hospice to bill Medicare for core services, which include nursing, social work, physical therapy, occupational therapy, hospice aids, medications, and durable medical equipment. The service areas of North Star Hospice have continued to expand. Services were originally focused in Hibbing, Chisholm, and the surrounding areas. This has expanded to reach further into Itasca County and the East Range areas. Also, in October 2007, North Star Hospice opened a satellite office in International Falls and is now serving Koochiching County. In 2013, it was decided to change our name to Fairview Range Home Care and Hospice. This transition is taking place to create consistency among the Fairview services and to eliminate any confusion about Fairview's care offerings.
I've worked in hospice for many years. It's my passion as far as my nursing career goes. It means working with the patient, but also with their family, their caregivers. It's the nursing elements and the emotional support, walking with these people through this path.
It's a very fulfilling career. I've done hospice for 9 years, and I think the best part is you know that you are there at one of the most important times in a family and person's life. It's very bittersweet, but you know you're helping them more now than they've ever needed help in their whole lives, to bring them comfort and peace in their final days of their journey.
Well, for me, I count it a great privilege to work with a group of people who just think more about the patient and the client and their families than they do about themselves. I've witnessed that over the last 4.5 years since I've been at hospice, and it's been a real joy to be a part of that team and to just see how everybody is so focused on ministering to the person and their families.
It is a special passion of mine. I lost my mother to leukemia 25 years ago, and there was no hospice at that time. And I made up my mind that if I could and had the chance, I would work in hospice and make sure that people who take this final journey are able to do it with as much dignity and comfort as they can. In September, I wrote to a special aunt and uncle of mine, and just it was Valentine's Day, I wrote them and told them how much they mean to me, what a void they had filled in my life after the death of my parents. And my aunt just passed away last week. And it was so comforting for me to know that I had sent that letter. And I don't know if I would have if I hadn't worked in hospice and worked with people and realized how important it is to say the things you want to say, to let people know you love them.
I've seen a change in my own life since I've been working at hospice in regards to being more sensitive to people's needs and just having a more clear understanding of who they are and the dignity that they deserve at this period in their life, and just made me more compassionate, I think, for people and their families and their needs.
Dealing with the end-of-life diseases, you learn to appreciate your health and your loved ones, and that you need to live each day because none of us knows what tomorrow will bring.
What you see these people go through, what their families go through, I guess the part that sticks out most for me is the grace that the patients have, the peacefulness that they find at this part of their life. It just amazes me to see someone come to their end of their life and be that peaceful.
I think the most important thing that people need to know about hospice, a lot of people are under the impression it's for very people that have cancer. There are a lot of diseases out there that can benefit from hospice. People who have congestive heart failure, lung diseases, blood diseases. It's not just about cancer. And just because you sign up for hospice doesn't mean your life is over. We try to make it the best part of your journey of life so you have great quality to your life.
We are not an organization that's just going to come in and take over and tell them how to do things. What we want to do is walk the journey with them, help them with home health aides, with spiritual help, with social worker, with nursing, all the aspects that could make that journey easier for them.
I think people need to know that it's more about living than it is about dying. Each person at hospice brings something different into the patient's life. It's not just about physical healing, it's about emotional healing and spiritual healing. It's about ministering to the family, and hopefully in the end the family will see that we really did care about them and their loved one, and just brought some joy into their lives at this difficult period in their lives.
The other thing that I think people should know, and this is the community and caregivers, is that what I may see as important might not be the most important thing. And I'd like to just tell a little story to show this. I had a patient who died from a leukemia, and I had been visiting with he and his wife for several weeks before he died. And on the early morning that he died, I visited their home, visited with his wife, talked to her about his passing, and I knew that he was going to be cremated. So when I was with him by his bedside, I asked the wife if she would like his wedding ring. And she said, yes, I would like that. And so I slipped his ring off his finger, and I walked across the room and I laid it into her hand. And to me, that was not a significant thing of what I had done with them over these months. But I saw her several times after over the next few years, and every time I saw her, she would pull the chain from around her neck that had his ring, and she said, I can just see, if I close my eyes, I can see your gentle fingers slipping his ring off, and the way you brought it over to me. And to her, that made a huge impact.
The hospice team did so many things to meet my dad's wishes and goals. They first came to our house to meet the family, to meet him, to get to know his personality and what exactly he wanted out of their help and out of this situation. And once it was determined that he did not want to have any medical intervention, that he just wanted to die in peace at home, in a loving environment, in a place that was familiar to him, and to live until the last moment doing whatever he wanted, eat as much as he wanted, watch TV all he wanted, drink his rum and coke or his wine. And as soon as he started needing the help, he knew that he could tell me, Chiqui, I think I need a cane now. I'm having difficulties walking. So I would call hospice, and immediately it was within, that same day they would send a cane. The next step of the process was, I think I'm going to need a wheelchair. And again, hospice brought the wheelchair. From there, he said, you know what, I think I'm going to need a hospital bed. And again, they brought the hospital bed instantly. And that was everything. Everything was according to what he needed. Hospice is really determined and focused on making the person that's passing make his last days and months or whatever the best they can, and for the family. They helped him. Then he said, I think I'm having pains. I need something for my pains. They provided the medication that was exactly what he needed for exactly his situation. And they kept him comfortable. So hospice met all of his needs until the very, very, very end. Well, hospice was a very, very important part in my process because obviously, nobody wants to say goodbye to their loved ones. I can't even begin to imagine anybody would. So having the preparation and having the people that have seen this over and over again, having them come and prepare you, hold your hand, listen to you, put a shoulder so you can cry, tell you that that at the end everything is going to be okay. That is critical. So when I decided to bring my dad here was because when you're going to die, you don't know when that day is going to come. It could be in a week, it could be in a month, it could be in a year. You really don't know. And so I said, I want him here where I can really take care and be in my environment with my family, with my husband, who's my family here. So having hospice became my family. I could call and know that they would be here immediately if I needed them, that they could answer my questions, that there was no schedule. There was no, oh no, you can't call, you can only call from 7 to 5 o'clock in the afternoon. No, if you need us at 2 in the morning, you call us. And if it was a nurse, she would come, and if it was the social worker, she would come. If it was somebody from the office that needed to explain something to us, they would come. The chaplain, I can't even tell you how wonderful that was. He sat with my father and with me and just listened or helped. It was just spiritual, and everything in that we needed, we got. So my needs were very, very much met, and I am forever indebted with hospice. Another very important part of hospice help was the home help aid, which is when you need a helping hand to bathe your loved one or to clean, if they're in a hospital bed, and they can hardly move, it is almost like dead weight. It becomes very, very hard for the for the caretaker to do it 24/7. And so having help an aide to come and clean the bed. It was a break for me. So cleaning him, changing a diaper, because it gets to a point where they need diapers. You know, in some cases, in my dad's case, that was the case. It really was very important to have that extra help, that helping hand, and the break that you get from having them here. One of the incredible things is that hospice also has a volunteer service. And in my case, it was beautiful because it happened. The person that was my volunteer was a person that is very, very close to me, and she lives in Pinquilly. Her name, well, she's Patty Miller, and I guess who doesn't know Patty Miller in the Iron Range and the world? But anyway, Patty Miller had never met my dad. She did know a lot about my father because, of course, as a friend, I talk and she knew a lot about my dad. But when she came for the very first time, it was beautiful because she came. My dad was already in his hospital bed, and I told my dad, I said, "Dad, you know, somebody's wants to come and just sit and talk to you, and I mean, listen to you. If you want to tell them something about your life or whatever, you can tell them." And he wanted to tell her a story of when he was a little boy. He looked like Shirley Temple, and he had 4 sisters, and they wanted to have him compete there was a contest of the one that looked more like Shirley Temple. And so he told that story to Patty, that he let them dress him with a Shirley Temple, you know, with a dress and all that. But the minute that they put the bow on his head, that he said, "Oh no, you take that bow off my head or I'm going to prove to the world that I'm a man." And so that story Patty remembers, and my dad had it was so good for his soul and for going back into his past to be able to share that story, which he had shared already so many times with us. So it was like telling somebody that he didn't know, sharing that moment. So those volunteers are such an important part of this whole process as well, because it's like meeting a new friend. They get to share portions of their lives that otherwise they probably wouldn't tell the members of the family, because they already know. So it gives the person the opportunity to walk through their lives and maybe share a funny or an important part of their life. So volunteers are another beautiful thing about hospice. He felt comfortable with those people that would come every day, or, you know, once or twice a week at the beginning, you know, whenever was needed. And he bonded. So when he really needed the help, he already didn't feel too bad about having that help, although it is hard when you can't clean yourself or get out of bed. So that part is never going to change. I think as human beings, we just hate not being able to take care of ourselves, especially the personal things. But you know what? It's like everything. After a while, you just are grateful that you do have that help and that attention, and that it's with loving people, and that you're not just one more number, or, you know, insurance policy holder, you know, in the sense that, yeah, you're just a number. Here with hospice, you're not. They become your family, and you become their family, and that makes it easier for them, because they know they'll get the help they need for themselves and for their families. So there. I would like other people to know that don't wait until the last moment. You should, you know, for us it worked beautifully that we started, when we knew that this was going to have an end sooner than later, that we could have a bond, so that when things really got bad and difficult, we were already a family, and they knew us enough, and we were getting all of our needs met in every sense. So just like you open the door to a friend and you're not sick or anything, they just come. Hospice is there to listen to you, to laugh with you, to cry with you, to give you advice, to show you or to prepare you for what's to come, which sometimes you don't know, and being able to know or what to expect, that is really, really important. So don't be afraid. Hospice is your friend.
Hospice care identifies the total needs of the individual and their family, including physical, spiritual, psychosocial, and emotional needs. Our hospice program is available to any individual who resides in the Fairview Range Home Care and Hospice Service area and has been certified by a physician to have 6 months or less to live. Some aspects of the hospice program are covered by insurance. These services include nursing, social work, hospice aides, physical therapy, occupational therapy, durable medical equipment, and medications related to the hospice primary diagnosis. The aspects that are not covered by insurance are financed through the Central Mesabi Medical Foundation Hospice Fund. This fund is used for non-covered medical supplies and massage therapy, our hospice chaplain, bereavement coordinator, and volunteer coordinator, grief support, volunteer recognition, staff education, and to cover any other expenses of uninsured clients. These are reasons why we raise money through grants, fundraising events, and ongoing community support. If you have any questions about our hospice program, perhaps you would like to volunteer, or you just want to find out how to make a donation, please contact us at 218-262-6982 or visit our website at www.range.fairview.org.